Good morning, everyone, and thank you for joining us today. Today, we have a very special and important topic. You may have heard the concept of social isolation and the impact that that has in multiple age groups. And today, I am joined by our early childhood specialist, Dr. Rumiana Kudeva, who's going to talk a little bit about social isolation in our community and efforts that are ongoing to increase awareness, knowledge, and access to information. So thank you for joining us today. And since I already mentioned increased awareness and access to information, I do know that you have been working on putting a series about social connections as educational opportunities for parents and caregivers. Can you tell us a little bit more about that?
Yeah, absolutely. Actually, we started last year
Okay.
because the idea is to move through the lifespan. So not just focus on one particular population, but work with everyone, right? So last year we started with prenatal to 5.
Oh, okay.
And this year we're moving with K to 12 population. Next year we're going to move to adults and then older adults. So the idea is to continue providing those, like creating those spaces for folks to come together and learn from each other. So we're really, it's open to anyone, not just to caregivers, not just to community members. It's open to professionals who have interest in working with a particular population. So this year, as I mentioned, it's K to 12. It's quite a broad range of, ages and needs and developmental stages. But really the idea behind getting this large group of people who support K to 12 is together is that we can learn from the different roles we have,
Right.
in community, and that's really where innovation happens, is when we hear about an idea and we try to imagine how it would apply maybe to a younger age or older age or different setting. So that's why we got really positive feedback last year from people who participated in the learning series, and we decided let's continue and let's continue be that convener and getting people together to learn and share ideas.
Okay. So, and I'm glad you mentioned a couple of things. One is that this is not just for parents or caregivers. This is open to anyone that wants to
Absolutely.
learn. And for those that don't know what this series looks like, can you give us a little bit like a 10 second? What does that look like?
Yes, absolutely. So it's a learning series. So we talk about how using the HOPE framework, healthy outcomes from
Okay.
positive experiences, can promote social health. And social health is really just that umbrella around social connectedness, experiences of belonging, of mattering, and creating opportunities like the right environments, for kids and youth. To feel seen and feel that they matter, in those settings and environments. We have presenters because it's learning series,
Okay.
so we have local presenters. It was intentional that we kept only local
Sure.
folks here, coming and present, because we really want to highlight the work, the great work that's happening in Spokane County, but also to connect folks, to each other. So the work is hard. So when we have that community of other people who do, good work in our community, I think that's where really we feel kind of fulfilled into why we got into this field and why do we care so much, about social health. And then we provide free lunch.
Oh,
We sponsor lunch for everyone because we know food connects folks, right? And then we have in the afternoon, we have Q&As and discussions. We have some hands-on activity for people who are there to kind of experience what we're talking about. And we moved through the series. That's why we broke it up to 4 different events.
Got it.
Because we moved through the different level of work that's happening with this particular population. So we start with individual level, then we're going to move to interpersonal level, to more like organizational community level, and then broader, like more policy environmental changes that we want to see.
So this is like about an hour each, or
Actually, it's a full day event.
full day? Okay.
Yeah, so
I'm
it's
glad you
like
mentioned
9 to 3 events. This year we work very closely with News ESD one-on-ones.
Sure.
So they're sponsoring actually the venue. So we're going to be at the Talbot Center.
Oh.
And it's a free event. We intentionally make sure we have enough partners and supports to provide that free event. So it's a very low barrier for folks to attend, other than find the free day, in a busy
Wonderful.
schedule. But yes.
Okay. Well, so by the way, thank you to our partners at ESD 101, Dr. Rucker and his team. We work very well with them.
Absolutely.
So you mentioned that we started this last year, and you started to talk about a little bit of the feedback that you received, and then I came up with another question. Let's go back to that. What kind of feedback did you receive, and how are you using that?
Yeah, surprisingly, actually, some of the feedback was around how isolated people felt
Oh.
themselves in doing this work. So that's why we really doubled down and said this is an important work, not just for the education piece, but really for that networking and connecting and getting people to to arrive at that common ground of like we can unite behind this common goal we have from the different roles we have in community. So we had people from businesses, we had folks from social services and public health and healthcare and education, all different kinds of fields that can actually really come together and unite behind that common goal. So that was one of the kind of like surprising takeaways, that people really themselves feel that they need to be connected, right, to other folks in community. Also, some of the feedback was around just some aha moments that maybe it wasn't such a new information, but it was that different perspective taking, that like other people may be working let's say, we had some breastfeeding counselors that came to talk about, peer support groups. And we had somebody from academia, who don't have really work with that, but they were saying like, it was really insightful to hear, how can we engage this concept of social health and social connection to promote then overall well-being and health.
So you're building critical adjacencies with other work that may not seem to be related, but actually there is some synergy. Well, I'm glad that you got that feedback. So talking about the events that are upcoming, if you had a magic wand, in addition to all the segments of the community that you just mentioned, who else do you want to see there? So we can invite them like right now.
I would say kids and youth. And I know it's difficult, to get out of school. Or activities, but that would be amazing to see actually the actual population we all want to support, to have them there.
Okay, so I think that will be interesting, and I'm sure working with our schools and parents, we can facilitate some of that. You mentioned that it's a full day, 9 to 3.
3, yes.
With a break and free lunch, _free lunch. And I think that venue has free parking where we're going. Okay.
Yes. So we're really excited for the Talbot Center because it has free parking. So again, and it's on a bus route, so we're trying really to minimize barriers and challenges for folks to attend.
So you don't have to worry about parking, you don't have to worry about food, you don't have to worry about access, you can take the bus, promote our friends from Spokane Public Transit with all the nice shiny buses that are very colorful nowadays, actually.
And kids
kind of interesting.
Kids ride
for free, yeah. So in addition to the training, if I cannot go to the training, because I cannot get the time off or whatever. As a general community member, what tips, what information can you share with me so I can become more aware and maybe create a better environment around myself or with my friends and my family, or even identify someone that may have kind of social isolation issue that maybe we should work on?
Absolutely. Thank you for that question, because a lot of times people see that as a professional issue, but really the impact we have as just community members, neighbors, friends, it's probably much bigger than a paid professional would have on somebody's life. So be social yourself. It takes time. I know social connectedness, we kind of take it for granted because we are raised with this idea that humans are social creatures, and we are, but we still need to learn social skills. We still, even as adults, we still need to kind of, polish those skills a little bit. It's very easy to isolate. It's a slippery slope, and it's very difficult to get out of there without some extra support. So if you feel isolated, reach out for help for sure. But if you notice somebody's more like reserved and not engaging, as they usually do, it's important for you to reach out, because it's very difficult to ask for help. So learn who's around you, learn what resources are in the community, so you can actually, offer some ideas of, how kids and youth can get engaged. We have such a rich community with so many opportunities, and we need to do a better job at like elevating those and making sure families know about them. And also, I'm a mom of teenagers, so I would say very
Look at you.
selfishly, yes, offer support to parents and caregivers of kids. We really need it. It's not just when you have young kids. Through those developmental stages, challenges change, and
Right.
we actually may need even more support for, when we hit those stages.
And kids never go away.
Yes, that is true. That is true.
Okay, but all kidding aside, I think it's important because sometimes when you're isolated, for whatever reasons, isolation builds isolation.
Absolutely.
You keep retreating into yourself
Yes.
more and more and more. And because I've talked to a lot of people that have had that issue, and then they just don't know how to get out. And sometimes all you need is someone to reach out and say, hey, let's go out for coffee and
Yes.
chat. What's going on with you?
Yes.
Because many times we are more likely to talk to someone that is not a professional
Absolutely.
because we feel more comfortable. A lot of people are sometimes concerned about going to a primary care provider or whomever. I don't know if this is big enough. This is not a clinical issue, which it is.
Yes.
But they don't know where to go. And sometimes you can just be that neighbor, that friend, that family member that says, I've noticed that you've been a little bit quiet lately. Everything okay? What's going on with you? Anything? Let's go out. Have some
Absolutely.
coffee. Notice I said coffee, so for the record.
Offer a meal. Offer to share
Over
a meal.
Yeah.
You
Yeah.
know?
So as you pointed out, food gets people together.
Yes.
I don't need to date. That's why I always say coffee, because for me, that's usually the getting together with someone means
Yes.
we're going to have, in my case, a double espresso. But other people do eat, as you pointed out, which is fine, But at the end of the day, I think, all kidding aside, what that means is, folks, sometimes anybody, for whatever reasons, we all have
Yes.
situations in life that all of a sudden we get overwhelmed. We just go
Absolutely.
inside and then don't know how to come outside again. And that can happen to anyone, anywhere. It happens, we see it particularly youth and young adults.
Vulnerable groups, yes.
Yeah, vulnerable groups over the age of 45. We see a lot of that in the more senior populations. I found the origin of that word, but I'm going to talk about it today because it goes back to the 1600s. But anyway, we do see that in some groups, and I think it's important for us to be aware of that. So anything else you want to share with the audience before we go today?
There's tons of actually opportunities nowadays to get engaged because of the Surgeon General's report that we got, I think, a year ago or 2 years now, on loneliness and social isolation. So it's the Foundation for Social Connections that is putting out a lot of resources. They are professionally, tailored, but also you can take that and implement in your social circles if you have book clubs or in your neighborhood groups. So there's so many opportunities for us to learn about this issue and remember that yes, we may be social creatures, but also as part of that, we need learning, we need supports, we need the right environments, for us to be able to engage with each other. So my advice is, even when it's not comfortable, just get engaged and push yourself to, go out there.
Okay. Well, I appreciate that, folks. Keep an eye out for the upcoming events. Is it 4 days, right?
It's 4 events
Four
throughout
events.
the year. So
events.
we have April, June, September, and November.
Okay, so keep an eye out for that all-day event, free parking, some food, and certainly you can learn a lot, and maybe you can make some connections there.
Absolutely.
Okay. Well, I want to say thank you to Remiana for her work and the team's work on that, and thank you to our partners for helping us move all of this, and thank you to the speakers for coming. And I agree with you, there's a lot of great work happening in Spokane. I think it's important for all of us to be aware of it.
Absolutely.
So with that, I'm going to say thank you for joining us today. Stay safe, stay well, and we will see you again next week. Have a great day. Thank you.